My name is James Broadhurst. You are watching Health Matters, a show about what matters to your health here in Central Massachusetts. This is a collaborative project by the Worcester District Medical Society and WCCA TV. Today, for this show, we're focusing on lung cancer and how to screen for it and how to get care early for it. It's a tough disease, and it's a it's a disease that is killing many people, and my guest will give you specific information about that. So I'd like to welcome Jean Comeau. She is a registered nurse, navigator for the lung cancer screening program at the Harrington Hospital in Southbridge,
yeah.
And also is the nurse navigator for a firefighter screening program, and we're going to learn more about that in a bit. So,
That's right.
Welcome, Jean.
Thank you. Thank you for having me. I very much appreciate being here. I'm happy to get the word out. The one really challenging thing about lung cancer, first of all, people should recognize that lung cancer is the highest killer of all cancers combined. It kills, more people die from lung cancer than breast and colon combined.
Is that right?
And part of the challenge with it is because the symptoms don't show until it's so far gone. And that's why we encourage screening. We screen regularly with patients who meet the criteria that were set up by the national standards.
I see.
And we have discovered that the percentage of positives we find in early finds are usually stage 1 and easily treatable and can benefit from all the advantages we have at Harrington, where we are part of the UMass system, so we have access to help, and the word navigate means to help navigate them through the system. And, and we have the resources of UMass so that if there is a positive finding, we have thoracic surgeons, we have oncologists, we have pulmonologists, so we have all the support staff, all the resources that are necessary to treat patients. In our program, we average about a 1.75% positivity rate, which fits in with the national average, which is 1.5% to 2.5%.
Wow.
So last year we screened over 2,000 patients at our Harrington site. And if you figure, 2% of that, if you or your family member was part of that 2%, you want to know that they're getting diagnosed early and treated early. And of that percentage that we had, 65% were stage 1 because we caught them early.
Wow.
We caught them early.
So our audience, I think, is most of us are nervous about a diagnosis of cancer. And somehow, I'm a family physician, and so I'm talking to my patients about getting screened for cancer, and sort of pretty much everybody knows about breast cancer and having a mammogram.
Correct.
That seems to be something that folks understand. Women understand about cervical cancer and getting a pap smear for screening for that kind of cancer. More recently, we've had screening for colorectal cancer, where you might have to provide a stool sample looking for hidden blood or for the DNA evidence, or maybe you have a colonoscopy. But now here comes lung cancer, and certainly from my perspective, people have been smoking for a long time, and there are some other environmental risk factors that I know you're going to share with our audience. But you mentioned that the signs, the indication that somebody might have lung cancer. I don't know. I think of people with a cough. Well, most people know that smokers have coughs. And I guess if you cough up blood, that might be much more concerning, unless you think, well, maybe I just have, something in the back of my throat, and it was just a sore throat or something like that, and it couldn't be from my lungs.
Well, to get back to what you first said about the smoking,
yes,
the number of people who smoke, one of the things people need to recognize is that the majority of people that in these programs are from a generation where smoking was easily accessible. When I was a kid, Lucy smoked on TV. Danny smoked. They all,
Right.
it was in the culture. But then, as we learned, all of us in the the dangers, then it became less common.
Okay.
But what happens a lot is, and why I think a lot of patients kind of hold back from getting screened, is that they think there's a stigma attached to smoking. And I've heard patients say, it's my fault. It's my fault I did it because I smoked. And we really try to discern that. We don't want to blame anybody. We don't want to put any kind of added burden on a patient. What we want to do is help them recognize that screening is going to help see what's going on with them. And if there is something going on with them, we can help them. We have the resources, as I mentioned, being part of a large organization, to treat patients no matter what level of cancer they have. And if they don't have cancer, all well and good, but they need to come back next year.
Right.
And that's a
Right.
big piece of my job, too, is, okay, you had your screening last year. It didn't show anything, so you're like, okay, I'm fine. But sometimes things sit dormant.
Right.
And I've had patients who've come 3-4 years in a row and have what they call lung rad 2, which means just benign nodules, and all of a sudden they're a lung rad 4X. Because whatever it was is, laying there dormant, and all of a sudden it exacerbates itself.
Okay.
And so we're catching it, we're catching it early. And that's what I try to get across to patients.
Fair enough. You've used this term lung rads, and I
I'm
wanna
sorry.
No, that's all right.
Yeah.
We're going to get back to that, but
Yeah.
and I'm not going to go down this side path too far, but I just want to say to you, when you were mentioning about stigma, that the dependency that nicotine induces in human beings is remarkable.
Right.
And so, you might say that it was a choice or something in the beginning, but it is not too long before human
absolutely.
beings just have a terrifically difficult time. So for you to reach out and to help people understand about this screening program is huge. So thank you so much.
Oh, that's okay.
for
Well,
doing
that's
that.
why we go to community outreach programs. We actually have one coming up at Harrington on September 7th, and we're out there and we're talking to people. We go to town meetings. We go, I go visit providers' offices. One of the things I try to do at least once a year, if not twice a year, is go to a provider meeting, just to, remind them. And we're very fortunate in our facility. The providers are wonderful about referring patients. And with the, as I said, the age has expanded from 55 down to 50. We're seeing a lot of these younger patients. The providers are so supportive of the program, and they're sending these patients in. And it's been remarkable, the numbers we're seeing. It's really showing that they recognize and that they're working with their patients to give them the best options.
Great. I'm eager for you to help our audience understand exactly who ought to be screened. And why don't we start, because you've mentioned cigarette smoking as a significant risk factor for lung cancer. How does somebody who smokes cigarettes know if they should be screened?
So the criteria that was set up by the United States Preventative Task Force is from age 50 to 80. And if they have a history of what they call 20-pack years. So what that means is,
I was going to say,
if you have,
year.
if you smoke a pack a day for 30 years, that's 30-pack years.
Okay.
If you smoke half a pack a day for 40 years, that's 20-pack years.
Okay.
If you smoke 2 packs,
packs a day, right.
yeah,
I get it.
Right, and so that's how it is. And if you're in that age group, then majority of insurances cover the initial cover annual screening.
Okay.
Where we run into a challenge sometimes with insurances is if they have a reason for to be called back in 6 months or 3 months for what we call a diagnostic screening. There often is because there was a question of what the radiologist saw on the film.
Right.
Then there often is a copay, or it depends on your deductible. But we work with the patient for that. We work with them and their provider, to see how it pans out. Let's make it as easy as possible, for patients. I did want, you brought up about breast cancer, and women are very good about mammograms.
Right.
So one program we've taken on this year at Harrington is called the Pink and Pearl Project.
Oh,
And
okay.
this was a program developed by the American College of Radiologists.
Okay.
And what it is if you think about it, October is Breast Cancer Month, pink ribbon. November is Lung Cancer Screening Month, white ribbon, pink and pearl. So it's a marketing program geared
Right.
to women, because women are usually very, very good about getting their mammograms. They're not so great about their lung screening. So we're trying to encourage them that when you're getting your annual mammogram, let's do your lung, if you have a history of smoking. So if you've smoked for what we call 20 pack years, or you've stopped less than 15 years, then let's get you screened. And
Okay.
we worked very hard at Harrington to do it on the same day.
Wonderful.
To make it easier.
Yep.
We do screening at Southbridge campus 7 days a week. We do them in the Webster campus 5 days a week.
Okay.
So, but we also, if, say the person lives in Southbridge, has a Southbridge PCP, but they work in Worcester,
Right.
and they want to have their lung screening done in Worcester or Marlborough, we work with them. We're all part of the same team. We're all under the same medical director, so we work very collaboratively together. And if our patient, it makes their lives easier to
Right.
go into Worcester or vice versa,
Yeah.
if they work out our way and live in Worcester,
Right.
we're happy. We want to accommodate them.
Okay.
We want to try to make it as easy as possible to get them in there. And I think that's, everybody's busy.
Right.
Everybody's lives are busy. We all have too much to do. So if we can make it a little bit easier, then we do that.
So you mentioned in passing, the guidelines are that if you're 50 all the way up to 80, and you have a history of 20 pack years, then you qualify. But then you said something about 15 years.
So if you've stopped smoking
Okay.
and it's been
So
less than 15
A
years,
person smoked a lot between age
20 and 55,
20
and they stopped.
and 55 and they stopped.
Right, and now they're 60,
Okay.
then their insurance will cover it.
Right.
And that's what it is.
But if they smoke from 20 to 40, or let's say 15 to 35,
Right.
and in that time they smoked 20 pack years,
Right.
but now it's 50 and they wonder should they be screened because they stopped 15 years ago. They don't need to be screened.
I'm not saying they don't need to be screened. I'm saying the insurance doesn't cover it.
Okay, fine. Why would they worry, why would they include something about if you stop smoking? I mean, do your lungs somehow get better?
Well, I mean, the research is out there that from day one, if you stop smoking, your lungs improve every day. And they're not going to improve 100%, but they're definitely, the longer you can go without smoking, the better off your lung health is. And, I'm not saying you don't need to be screened if it's been 15 years, and that's
Right.
certainly something for you and your provider to discuss.
Right.
And again, depending on if you have symptoms.
Right.
And the classic, as you said, all smokers cough. They get up in the morning and they have smoker's cough.
Right.
But is it an uncontrollable cough? Are you coughing up blood? Are you short of breath? Are you short of breath with exertion? And then that's when we can then work with the provider and say, okay, maybe they don't qualify for lung screening, but let's look at what else they could qualify for. That they're,
Got it.
because insurance kind of dictates what we all do, unfortunately. We have to fall into the parameters, but we can work with the provider
Right.
to help guide them in a direction to offer the best care possible to the patient.
Wonderful. Let me just spend a moment to say to our audience, you're watching Health Matters, a show coordinated by the Worcester District Medical Society and WCCA TV. This show, we're focusing on lung cancer screening. I'm joined by my expert nurse navigator from Harrington Hospital, Jean Comeau, and we're talking about screening and who qualifies.
Right.
We've focused a lot on lung cancer, on cigarette smoking as a risk factor. What are other
There's
reasons that people might want to be screened?
there's the environmental.
Oh.
you know. And again, then you run into what's covered and what's not covered. So then it's unfortunately symptom-based as far as insurance is concerned.
Oh,
But,
I see.
you know, because you have people that have exposure to asbestos, you have, you know, and the Go-To Foundation, which is the National Organization for Lung Cancer, you know, is always working with Congress and Medicare, trying to look at how we can get these other symptoms incorporated. But at this point, that hasn't happened yet.
Okay.
So then again, we work with the provider. How can we help this patient the best way possible?
Right.
And it might be a nice segue into the firefighter program.
Well, I want to get to the
Okay.
firefighters
Yep.
in a moment, but I'd like to talk specifically about the screening, because in my practice lifetime as a physician, in the old days, basically we had chest x-rays.
Right,
And then along came CT scans.
right.
And appropriately, folks these days are aware that x-rays and CT scans actually have a fair amount of radiation, and that if somebody gets more radiation than their body can take, maybe the radiation causes cancer. So what is, are people being asked to have high-dose radiation kind of scans for
So
the
for the
screening?
lung cancer screening program, it's done under low dose.
Oh,
It's low
okay.
dose,
Right.
right. And it takes a lot of radiation exposure for someone to get cancer. I mean, there's a radiologist from Leahy who speaks a lot at the conferences, and she's talked about that. And she, you know, because when you work in the field, you wear a badge that measures the radiation. And you know, she's talked about how she's been doing this for X amount of years, and her badge is never filled up, and she does it every day. That doesn't mean it couldn't happen to someone. I'm just saying it isn't the norm.
Right.
Now, if you're talking about things like radon exposure, or, you know, other things like that, that's another whole other issue.
Well, so radon. Tell me about radon.
I don't know that much about it, to be honest with you.
Okay,
You know, it's kind
fair
of out
enough.
of my purview.
Well-
But, you know, it's just one of the ones that can cause problems. But as I said, it doesn't qualify in the program. So again, we would work with the provider to try to help them get what they need.
Got it. My understanding as a family doctor is that it's a gas that is prevalent in New England, and if you might get concentrations in the cellar. And so if you've got a cellar that, particularly an older one with lots of cracks and stuff, maybe you want to get it checked and find out. But the point is, that's another, so we've got asbestos, and we don't see very much of that anymore.
Not
but
too much.
Back in the day,
Yeah.
people who were working building ships and things
Right.
like that were exposed. There are homes that have asbestos insulation and things. Are there other risk factors? We've got cigarette smoking is the big one.
Right.
Right? And we've talked briefly about asbestos and about radon. Are there other ones that come to your mind as you talk to?
I mean, not for this type of program, no.
How about family history?
Well, that plays a part. You know, it's
Okay.
like with any other type of cancer. But again, like, for example, breast cancer, half the patients with breast cancer have no family history.
Right.
It's the same thing. That is one of the questions when I do an intake form when the patients come in.
Right.
And that is one of the questions I ask them is, do you have a family history of lung cancer? And it's really, at this point, we're doing data collection to just see. But again, I think it falls into the same area of the other cancers. It could happen and it couldn't. And
Okay.
it can contribute, but it doesn't always. You could have someone who has no history in the family at all, but
Right.
and they all smoked. But this one person, for whatever reason, developed the cancer, and I think that's,
Right.
challenging. Yeah.
So let's talk about firefighters,
Yep.
because certainly from where I sit, firefighters have been in the news recently. They've been in the news for a long time about the danger of their work, and not just the fire itself and that, but the inhalation of smoke and other particulate matter and so on. But they've also wear protective equipment, which has been manufactured with these chemicals that
Right.
are forever chemicals. So that's another issue. I don't think that's tied necessarily to lung cancer.
No.
But clearly that occupation has risk for lung cancer. Is that correct?
Correct, and there's actually a woman from Worcester who's been way out there, right out there in the news with, I think her husband was a firefighter, about the gear, as they call, the turn on gear or whatever they call it. Anyway, yeah, there's a lot of issues with it because that, like everything else, as we learn, just like we learned with smoking, they're learning that years ago they didn't wear anything behind their neck, and they're seeing skin cancer from that exposure.
I see.
Because it's the same, we follow the same protocol as far as the chest CT as we do at lung screening, because they're exposed to the same ideas, have the same risk for lung cancer. Our firefighter program is actually a cardiovascular and cancer screening program.
Okay.
Because firefighters have a high risk of
Cardiovascular disease as well.
Heart
attack,
cancers, correct.
Strokes
and
things like
right,
that.
and we look at abdominal. We're looking for triple abdominal aortic aneurysm.
Okay.
We're looking at thyroid cancer. We're looking at obviously lung. One of the things I did want to mention with actually both programs is we follow also. Not only do we follow the positives, because we follow the incidentals.
Oh,
because you see a lot of incidentals. Think of a chest CT. You're going from here to here.
Right.
And you see things. You see things. You might see something in the breast. You might see something in the mediastinum. You might see the top of the, a piece of the liver.
Mediastinum,
the chest.
center
Yes,
of the
I'm sorry,
chest
the
here.
center. Yes.
Right. Okay.
A
Got it.
piece of the liver. You might see some of the kidneys, and so
Yeah.
then they would then recommend further diagnostic studies. And we follow that in both programs because we've found quite a few things. So that's, again, the part of having a comprehensive program is that we're looking at the whole patient. I'm not just looking at, do they have lung cancer, and then I don't care if they don't have anything else.
Right.
I'm looking at, do they have anything else that's compromising their care? And we want people to be healthy, we want them to be safe, and that's the best way we can do it, is to make sure we're looking at all of them.
So the process is that somebody wonders if they should get screened, and they can call your program, or they could, I know there are programs, said in Worcester,
Yep.
I think both at the St. Vincent Hospital as well as at UMass Memorial.
Yep.
You told me an interesting thing about screening and availability. We'll get to that in a minute. But just the process, let's say at Harrington,
Yep.
A person calls and they go through a questionnaire kind of thing,
Right.
interview?
So
or?
let's just use the example of at a community outreach program.
Great.
Somebody
Okay.
comes up to me, and I have a small intake form, and they say, gee, I don't know if I should have a lung screening.
Right.
And so then ask them, how old are you? What is your smoking history?
Right.
And then, who's your provider? Because one of the big challenges, mammograms don't require a doctor's order.
Okay.
Lung screening does. So does firefighter screening. It requires a doctor's order.
So
Or providers, I should say,
provider.
provider's order.
I hear what you're saying,
Yeah.
and you're absolutely right. So if a person wants a mammogram, they can go to a mammography center and just get one.
Right.
I see. Okay.
Right.
But that's
And so-
not true for
No,
lung
that is
cancer
not
screening.
true with the other programs. So what we do is, and again, I'm just using the community outreach as an example, fill out the form, find out who their provider is, get obviously their demographic information,
Right.
and then I contact the provider and say, whether if they're in, if it's in the UMass system or out of the UMass system,
Right.
whether I do it electronically or by paper.
Right.
Mr. Smith, would like to do it. He qualifies. Here's an order. Would you please sign it? And
Right.
as soon as they sign it, we book them,
Then you can go ahead.
and then we can go right ahead and do it.
And the actual screening, as you said, is a low-dose CT scan.
That's
So
right.
What does that mean?
So it means
what's
it
a
does-
CT scan look
So,
like?
so a CAT scan machine, it's not the MRI. A lot of people say, "Is that the tube? I'm claustrophobic."
Right.
No, it looks like a big donut.
Okay.
It looks like a great big donut.
Yeah.
And the chest CT takes less than 5 minutes.
Really?
Less than 5 minutes. It takes longer to do the paperwork.
Okay.
You know, and
Yeah.
and if they're nervous or they're anxious, then our techs are wonderful about talking them through, you know, and it's just lay on the table,
So you lay
lay
down.
flat on the
And
table.
the thing moves, does
Then
it,
the
or
move,
something?
right, the donut is stationary.
Just donut stays
Yeah,
there.
and the table moves
table
in,
moves.
it goes just over your chest, your head's out,
Yep,
your legs are out.
okay.
So if you are a little claustrophobic, your head is always out.
Do you have headphones to listen to music or
No,
anything?
because it's less than 5 minutes.
Because it's so quick.
It's less than 5 minutes.
Okay, then.
And then in and out and done,
Okay,
and that's it.
wonderful.
It's very quick, you know. The firefighter screening is obviously more involved because we also do a calcium scoring chest CT, and we do several ultrasounds.
I see, okay.
So
So that's a more involved.
more
but
comprehensive.
it's designed to meet the needs of people in that profession.
It's
Right.
right.
Doing
The
that work.
protocol is set up to meet with the specifics of the fire services,
Mm-hmm.
and we have programs where we work with towns directly. Because
Right.
some towns, I'll give you Southbridge as an example.
Sure.
They've worked it into their contract that they will pay for so many a year. So I work with their chief, and he'll, you know. But we
Right.
also have a grant with Mass Fire Services. UMass has the same grant, and actually Mercy has the same. Mercy in Springfield has the same grant for the firefighter program. And if they want to come in through the grant, I refer them to the Mass Fire Services. Once
Right.
they meet they have an education program they have to do first, and they send it, and then we get an order for them, and we
Fair
go
enough.
ahead.
We have listeners who live in different parts, actually, of Massachusetts, and our listeners may have friends. Talk a little bit about availability of lung cancer screening.
Well, one of the things I've found challenging is Worcester County has the highest percentage of smokers in all of Massachusetts. And I think a lot of that has to do with there's a lot of mill towns and rural areas. However, the majority of screening centers are east of 495.
Okay,
You know, in Worcester County, we have, as we said, UMass in Worcester, which also has sites in Marlborough, Clinton,
right,
Leominster, and Worcester.
Right.
And then we have Harrington in Southbridge and in Webster.
And
And
St.
then St.
Vincent,
Vincent's is
absolutely.
in Worcester as well.
Right.
Then you don't have any until you get to Springfield.
okay,
And you have Mercy and Bay State. And then you don't have any until you get to Albany.
I see.
So, you know, it's challenging.
All right, well, I'm eager for our listeners, if you know somebody who might qualify for lung cancer screening, please get the word out to them and let them know that it is available. They might have to look a little bit. They can certainly ask their primary care provider to get more information about that. I want to thank our guest, Ms. Jean Comeau
okay.
from Harrington. I'd also like to thank our terrific engineer, Frank Rocco, for his work in making sure that you can see us and hear us. My name is Jay Broadhurst, and thank you for watching this edition of Health Matters.
Thank you.